Retinal surgery is a microsurgery that's used to treat conditions of the retina, often referred to as vitreoretinal surgery. The most common conditions that we treat as vitreoretinal surgeons are retinal detachment, macular hole, epiretinal membrane, and conditions and complications related to diabetic retinopathy. So retinal surgery is a surgery that's performed in theatre. We use a high-powered microscope and go through the white of the eye, the sclera. It's often compared to a type of keyhole surgery or laparoscopic surgery. In effect, it's very, very small incisions. I think that this can be formed in the local anesthetic or general anesthetic, depending on the patient's needs, and generally takes between 40 minutes and an hour. So retinal surgery or vitreoretinal surgery carries risks like any surgery, namely that's of not being able to improve the condition that you are intending to treat, perhaps around a 1 in 100 chance of making things worse. So cataract surgery and vitreoretinal surgery are both types of microsurgery performed in theatre with a high-powered microscope. Cataract surgery is perhaps the most common operation in the world. And is performed routinely under local anaesthetic. It takes around 20 to 30 minutes to do. Retinal surgery, same in theatre with a microscope, generally takes longer, perhaps up to an hour, or very complicated cases, perhaps an hour and a half. So recovery after retinal surgery can be quite variable, actually. Will obviously depend on the condition that's being treated and that time it takes for things to get better and improve. I believe the recovery period is most likely influenced by the occurrence or not of a gas bubble, so a need for a gas bubble during the surgery. You may have heard that with a gas bubble you may need to posture after the surgery, whether that be face down or lay on your side, but very much depends on the type of condition. In macular hole, this would be face down posturing perhaps for about a week after the surgery. For surgery such as retinal detachment, it would depend on where that retinal detachment started and the tears and position on the retina.